Hello, welcome back to this channel where we talk about the basic medical information making a big difference. If you are new here, kindly take some minutes and subscribe. And if you're a returning subscriber, thank you so much for always coming back to watch my videos. My name is Rebecca Moranki and this is the best place to be. In the next few minutes, we are going to look at hypothyroidism, or what we call underactive thyroid. Hypothyroidism, this is where the thyroid doesn't create or release enough thyroid hormone into the bloodstream. It is a very common condition where your metabolism slows down, and actually it affects your entire body. Sometimes it doesn't have noticeable symptoms, but many times some symptoms can be noticed, and many times if it's not treated, it can lead to high cholesterol and what we call heart problems. What are the symptoms of hypothyroidism? Many times some people feel or they get more sensitive to cold, they feel tired, they have dry skin, weight gain, hoarse voice, muscle weakness. Others develop what we call thinning of the hair. Some people get depression, and others can have what we call memory problems. Now, does it affect a specific age group? No. This is a condition which affects all ages. It affects infants, children, and even teens. And what are some of the symptoms in the infants, children, and teens? The infants, many of them develop what we call poor growth, poor weight gain, constipation, poor muscle tone. Others have dry skin. Others have the enlarged tongue and what we call umbilical hernia. This is actually the swelling or the bulging of the belly near the belly button. Now, what are the causes of hypothyroidism? We have two main causes. We have primary causes and secondary causes. The primary causes is where the condition actually impacts the thyroid directly, causing it to create low levels of thyroid hormones. Come to the secondary causes. This is where the pituitary gland fails. It cannot send the thyroid stimulating hormone to bring balance for the thyroid hormones. Remember, thyroid stimulating hormone, it stimulates the thyroid gland to release the two hormones, the T4 and the T3. So if the pituitary gland does not secrete this thyroid stimulating hormone, there will be imbalance of thyroid hormones. Now, those are the two major causes of hypothyroidism. Now, from the two major causes, we have causes of primary hypothyroidism. One is what we call autoimmune disease or Hashimoto's disease. This is a condition which actually where your immune system makes antibodies that attack the healthy tissues. Hence, it prevents the thyroid from making and releasing enough thyroid hormones. Another primary cause is what we call thyroiditis. This is the inflammation of the thyroid. In most cases, the thyroid can trigger or can release the stored amount of thyroid hormones, all of it, and brings what we call the thyroid spike. This one will bring a condition what we call hyperthyroidism, and eventually it leads to hypothyroidism. It starts with hyper because it has released all stored thyroid hormones in the thyroid, and then it eventually develops what we call hypothyroidism. Another primary cause is what we call thyroidectomy or thyroid surgery. Remember here, this is where the thyroid is totally removed. All part of the thyroid gland is removed. This one will bring the level of the thyroid hormones down. So if it's totally removed, you have to be on thyroid replacement therapy, where you have to take levothyroxine. This is a drug which will bring balance to your body by secreting the two hormones, the T3 and the T4. Now, another primary cause is what we call radiation therapy, which will lead to hypothyroidism. Some medications will lead to hypothyroidism. Medications which are to treat other conditions like lithium, which is used to treat psychiatric disorders. Another cause is iron deficiency, can lead to either hypothyroidism or hyperthyroidism. Why? Iodine is a mineral which is needed to manufacture the two hormones in the thyroid, or to make the two hormones. If you have iron deficiency, you will have this condition. Mostly we get iron from seafood and even plants which are grown in iron rich soil. But remember, if you take a lot of iodine, it will bring problems. So it's good to keep the balance. Another cause of hypothyroidism, primary hypothyroidism, is what we call hereditary condition. Actually, this is passed. We say this condition can be passed from one generation to the other, but not all that common, but it's one of the cause. Again, we have problems at birth. When children or the women give birth to young children, some defects can occur during birth, which will bring a problem to the infant, hence leading to this condition we call hypothyroidism. Another condition is pregnancy. Pregnancy, you can develop this condition during pregnancy or after. During pregnancy, it can lead to premature delivery and even loss of pregnancy. During pregnancy, again, somebody can develop preeclampsia. This is where you have high blood pressure during pregnancy. This is a condition which somebody can develop if she has this condition of hypothyroidism. So it's good to look for or to seek for treatment if you have this condition. Now, how is hypothyroidism treated? Hypothyroidism is treatable, but before it's being treated, you have to do what we call blood tests. Now, which is the best blood test? Blood tests actually here, they test the level of thyroid stimulating hormone or thyroid stimulating hormone test. When this test is done, if it comes back with high level of thyroid stimulating hormone, the test is repeated again with the T4. So if the T4 is low and TSH is high, that is a confirmatory test of hypothyroidism. Treatment is by taking thyroid hormone drug, which is levothyroxine, which somebody has to take the whole of his or her life, and monitoring should be done to ensure that one responds well to this medication. Regular checkups for the thyroid hormone levels are done, and then to ensure these symptoms are minimized. What are the complications of hypothyroidism? One is goiter, the enlargement of the thyroid gland, heart failure. If somebody is not treated, can develop a problem of the heart, or the heart will finally fail. Peripheral nephropathy, this is what we call the nerves which bring information from the brain to the spinal cord and to the entire body. Somebody can develop pain because if these nerves are damaged. Infertility, because hypothyroidism interferes with ovulation. Another complication is birth defects. This happens during birth. And another condition we call myxedema, a threatening condition, life-threatening condition, where somebody becomes weak, all what we call lethargy. You lack energy, you get confused, weakness, breathing problem, your heart can fail, low body temperatures. So those are some of the complications somebody can develop if he or she has this condition of hypothyroidism. Up to this level, I believe you have gotten something, and kindly continue to subscribe, share the link, give the video a like, and let's meet in the next video. Bye bye.